Hello guys, how are you all? Today we will discuss AMC Part 1 recalls from the Gynae section. So let's start the question discussion. Which one of the following is the most common cause of cesarean section in Australia? A. Failed progress of the labor. B. Previous cesarean section. C. Cephalopelvic disproportion. D. Cord prolapse. E. Fetal distress. So actually all are the causes of the cesarean section, but here they are asking the common cause of cesarean section delivery in Australia. So the most common reason to perform cesarean section in the current pregnancy is the commonest indication is previous cesarean section. Due to this indication, this is the most common cause for the cesarean section delivery in the current pregnancy. Otherwise all are the causes for the cesarean section. So the most common cause of performing a cesarean section in Australia is a history of previous cesarean section. So the correct answer is B. Previous cesarean section is the common reason to perform a cesarean section. The other causes of performing cesarean section include failed progress of the labor, cephalopelvic disproportion, quad prolapse, fetal distress, fetal malpresentation, especially breech, placenta previa, and failed induction of the labor. All are the causes of the cesarean section, but the most common reason is previous cesarean section. Next question. A 26-year-old woman with a history of chronic immune thrombocytopenic purpura ITP present to your clinic and seeks advice regarding pregnancy. She has a platelet count of 70,000 per mm cube. Which one of the following is the correct statement in counseling her? A. She should have a splenectomy before pregnancy. B. She should avoid pregnancy in the next 2 years. C. She can become pregnant. D. If she become pregnant, the mode of delivery should be assessed by cesarean section. E. She cannot become pregnant while the platelet count is below 70,000. So what is the correct statement in this option? The correct answer is she can become pregnant. Let's see the explanation for this answer. While uncommon, immune thrombocytopenia (ITP) is an important cause of thrombocytopenia in pregnancy. Actually, this is the uncommon cause, but it is an important cause to rule out, either as a pre-existing condition or occurring at any time during pregnancy. ITP developed in the pregnancy is important to be distinguished from incidental or gestational thrombocytopenia, which is responsible for up to 80% of cases of thrombocytopenia in pregnancy women, or it should also be distinguished from other serious cause like HELP syndrome. Gestational thrombocytopenia usually causes an approximately 10% decrease in the platelet count and is usually characterized by the count that are above 70,000 per mm cube. When platelet count lower than this, it is mostly ITP. So in gestational thrombocytopenia, the platelet count will you will see above 70,000, but if it is below than this, then it is mostly the diagnosis will be going toward ITP. A diagnosis of ITP is usually made in 1 to 4% cases of thrombocytopenia, and ITP, either pre-existing or developing during pregnancy, does not prevent a woman from becoming pregnant or safely delivering a healthy baby. The best advice for this woman is that she can become pregnant, and ITP does not preclude the vaginal delivery. However, the pregnancy is categorized as high risk, and she will need extra care and probably treatment, especially around the delivery. In pregnant women with ITP, treatment is usually not necessary as long as the platelet count is above 30,000, unless there is a bleeding or easy bruising. So if there is a bleeding, easy bruising, then the treatment is necessary. Otherwise, if the platelet count is above 30,000 and the patient is asymptomatic, no treatment is necessary. For pregnant women with symptomatic platelet count of above 30,000, if 30,000 above with a platelet count and patient is symptomatic, or women with a platelet count of below 30,000 regardless of the symptoms, treatment either with prednisolone or intravenous immunoglobulin IVIG is required due to significant concerns of bleeding, especially uterine bleeding. So this is the important point. If the platelet count is above 30,000 and patient is symptomatic, or if the patient is having a platelet count below 30,000 regardless of the symptom, then in these two conditions immunoglobulin or prednisolone treatment is necessary. So there are the concerns of bleeding, especially the uterine bleeding. It's important to maintain the platelet count that allow the pregnant woman with the condition to go through delivery. The safe count is at least 50,000. For regional anesthesia, count should be between 70,000 and 1 lakh is open demanded. This is the explanation for this question.